Suicide is the 10th leading cause of death in the United States, with nearly 45,000 people dying by suicide each year. It's an age-old problem, but within psychology, suicide prevention is a fairly young field. Until recently, after 50 years of research, our ability to predict suicidal behaviors was essentially no better than random chance.
No one factor or even, small sums of 5 or 10 factors predicts much better than random guessing.
Thanks to psychologists like Franklin, his colleagues, and others working together across the field, that's changing.
What we decided to do was to say, what if we put a lot of those factors together, maybe even hundreds, and we didn't just add them together, but we used something called machine learning in order to find an optimized combination of those factors. So we basically went from around chance level prediction with traditional methods to, depending on what metric you use, somewhere in the 80% accuracy range in predicting future suicidal thoughts.
So psychology has helped us become better at identifying when a person may be at risk of suicide. But how can we help people once we know they're at risk? Psychologists are helping there too.
Well, up until about 15 years ago, suicide was thought to be a side effect of other kinds of psychiatric disorders. But more recently, we've had more research focusing specifically on reducing suicide. And we've developed several empirically supported treatments now that reduce suicide attempts.
One such intervention is the Emergency Department Safety Assessment and Follow-up Evaluation, or EdSafe.
In the EdSafe program, patients from emergency departments with suicide risk who received a telephone-based, values-oriented psychotherapy program had 30% fewer suicide attempts over the subsequent year.
Other psychologists developed interventions like dialectical behavior therapy and cognitive behavioral therapy have also proven to be effective.
We found that brief intervention of the teen between 10 and 12 hours using brief CBT was able to reduce post-treatment suicide attempt rates by 60%, the largest reduction in history to date.
But evidence-based treatments like Rudd's brief CBT intervention still aren't widely used.
And one of the things that we've been concerned about is the need to get policy experts involved to actually start to mandate and require some frontline treatments like validated care, like brief CBT.
And psychologists from across the field are working with policymakers to make suicide prevention a national priority.
I'm Jane Pearson. I'm a psychologist working at NIMH, and my role here is to advise our director on suicide prevention research right now.
Like APA, NIMH is one of 250 partners on the National Alliance for Suicide Prevention, a public-private partnership to advance and update the national strategy for suicide prevention.
So the National Action Alliance for Suicide Prevention started in 2010. And it allows both federal groups, agencies, and private partners to work together to advance suicide prevention. And one of the components to that is the National Violent Death Reporting System. And that allows existing data to be gathered and systematically looked at by each state. And that's been really important to understand trends and how deaths occur, methods, precipitating events, things like that.
To learn more about how psychologists are helping to stop suicide, check out our feature in APA's Monitor on Psychology.